Good afternoon, everybody. I am Kelly Schwartz, as you know, the CEO of Schwartz Consulting Group. I am joined today by a friend, Ryan Corby. Ryan and I go back a little bit. Ryan and I had been talking numerous times about the benefits of having an in-house membership plan and how we see them to be helping our clients. And then wanted to give you a little more of a firsthand exposure to Ryan and what their program entails and why we have it. So, we have been coaching over the last 30 years, over 850 practices throughout the United States and Canada. And how Ryan and I got hooked together is one of his partners, Dr. Jeff, out of Kansas City, right? Is it actually Kansas City?
St. Louis, Kansas City. Yeah, Missouri. You got that right. Yeah.
Right there. Worked with him and his partner, had great success. Also, a name you may be familiar with, Dr. Chris Phelps. I was Chris's first coach and consultant, worked with him for many years, helped him develop some of his programs on the initial phase, was a proofreader of his book, and just a great guy. He's a neighbor of mine, a friend of mine, and just a great person all around. So we have a lot of mutual respect and friends with one another. And so this is why we're here today. So, um, Ryan, tell us a little bit about yourself and about how this all came started for you.
Yeah, absolutely. Thanks, Kelly. Lots of overlapping circles as much of dentistry is a big industry, but a small town, small circle. So I've greatly appreciate all the relationships that have come through Phelps and my partners, Dr. Sindelar and Dr. Craner. And yeah, long time coming to finally get together and talk stuff out. Yeah, so I'm CEO of Smile Advantage now. My partners are the kind of original co-founders of Smile Advantage. They are practicing dentists in St. Louis, kind of surrounding area. The classic thing, we're tired of getting reimbursements going down and the difficulty with insurance, and did not necessarily invent the idea of membership or in-house sort of membership plan, but they became pretty successful with it right out of the gate, and realized that the long-term success for their practice would be really dependent or at least enhanced by sort of in-house membership or traditional an option to traditional insurance. So how I got involved with them, I'm actually a marketing guy by trade. I've had a marketing agency in dental for over, gosh, 12, 15 years now. They became clients of mine first, and then through sort of our initial conversation, realized some real strengths that we could play off of each other. The kind of concept and theology that Dr. Craner and Dr. Sindelar had on membership dentistry and the vision for what it could become in the industry and help the overall industry and their colleagues and other professionals in the space, and my sort of expertise in automation and marketing and development and technology, and bringing those sort of two things together. So fast forward, became business partners, and now run Smile Advantage together as a small team. We've kind of had the original version of just making some sort of automated renewal process very easy for dental practices to implement their membership program, but then also help grow it. And that desire sort of initially started off with some consulting on how to just set up and monitor and moderate your membership plan, and less on the philosophy of why, even though that's kind of involved in there, but really the execution of managing and growing it from a tangible sort of technical perspective. So fast forward to today, what Smile Advantage is a very robust fintech platform. That's the kind of techie stuff that we talk about. It's a full payment system and deeply integrated to the practice management software, and highly designed workflows that are really built out of the practice. My partners still practice every day, so we're practicing on their practices every single day, and then trying out new workflows and hearing constant feedback from our other clients and them as well. And ultimately, our goal for Smile Advantage is to really be, as boring as it sounds, a financial tool, a very robust financial tool for dental practices that does, its core is based on fee-for-service style payments and membership and everything now that we do, from payment plans to text to pay and online payments and all the stuff that kind of come with that. But our real foundation has been built on our philosophy and belief in membership dentistry, and so on. So we built a pretty cool platform that helps that, and then we still help on the growth side of that as well. But bring that back to why we love working with folks like yourself and your team and Dr. Phelps and some other of the expertise, is really bringing that clinically trained and team training expertise to the tech backend that we've kind of created. And really, we see that as a great merger. We'd love to have a great tool that works with your clients. And when you speak and, teach about membership and the effectiveness of it, we can mirror our very robust software to help that grow. So we've always appreciated working with you. And again, Dr. Phelps, to bring that along the way here. Been fortunate to sort of merge Dr. Phelps's previous membership company into Smile Advantage here, and it's been a great success. And to bring full circle here between you and him and all of us together and Dr. Sindlar, it's a pretty cool moment. So that's what Smile Advantage is. We're here to really give the practices a very powerful tool. There's a number of other very powerful tools. Obviously, Dental Intel is another one that you and I are pretty connected on. That's a powerful tool in the practice. And we really believe that Smile Advantage can be much more than just a membership software, but really a complete software that can help the practice run several other things. Now, we're not going to get into review management and appointment reminders. We're going to stay in our lane of membership and payments there. But yeah, that's who we are today.
All right. So one of the things that I've found overall is, having a membership plan. And I don't know if I've ever told you this story, Ryan, but many, many years ago, I was working with a doctor up in Michigan, Dr. Danny Fox, and Danny he was in the Livonia area, and a lot of his patients were members of the big three automakers, and their union cut their dental benefits, which meant a lot of his patients uh, couldn't have or didn't have insurance of any kind. So Danny and I put our brains together and we came up with an in-house plan or a membership plan back then, geared specifically at the auto workers so that they could still get dental coverage at a reasonable price. But really, what we found was all about retention, right?
Mm-hmm.
So by getting a patient signed up for the 2 cleanings a year, you almost guarantee they're going to come back to you. And also, if they're going to need work, we thought, why not? Because they're coming out of pocket, they're not dealing with the insurance. Why not give them a little break on the pricing? And the spinoff of that was also then improved case acceptance. So
Mm-hmm.
we got patients that were coming back twice a year, which was great for the business. We had patients saying yes to treatment because we had payment options and a little bit of a savings, we'll call it. And we saw how that was really, really helping our teams, if you will.
Mm-hmm.
So why don't you share with us, let's start with the basics. How does your program work, and tell us about it from your side.
Yeah, you hit the nail on the head on several things there. I think in addition to the financial sort of benefit to both the practice and the patient is really just the clarity and simplicity of it. Again, you're just removing that whole middleman and all the debacle with denials and approvals and, all kinds of fun stuff. As a side tangent here, I'm helping one of my partners the other day using modern AI tools to help come up with a better narrative generator to like have them submit this simple script to insurance because all the hoops they have to jump through and say all the right things. And if the narrative that they submit doesn't meet all the things and is immediately denied, and it's like just the debacle that they have to
It's a
make it.
barrier to high
It's a,
quality care, is what it is.
Absolutely right, because the more administrative overhead that the practice has to have, the higher the costs, and then the higher costs they have to have. So yeah, it's absolutely a barrier to entry on everybody and everything, but to care. And so I think that's what we love about the membership model is it lowers that barrier to entry. Even when people think, well, what if they're going to be paying out of pocket? Well, everything can sort of settle down to a reasonable fee now, even if you're giving sort of a discount, because even if you're giving a discount off your UCR fees, the dentist is still taking home more money in their pocket. It's a little bit of an incentive to the patient, and just a better deal all day long there. But I think that's what really the membership model ultimately does. At the end of the day, my opinion is that the membership model is not rocket science. It's really just a financial vehicle and a nice little way to put services in a little bundle and a little bow on top and make it very easy for the patient to understand and cover, and also actually be profitable for the dentist as well. So, again, that's why our core is really built on the financial tool of that, and as sexy or non-sexy as payment processing in as the technologies. But really, that's what it is. It's just putting those services and simple preventative sort of services in a nice little bundle and a bow on top that the patients can understand it and have their patient
One of the things we found is, patients, we have a lot of systems for retention, follow up, and so forth. And it's really all about communication. And one of the areas that we coach our teams on is, we'll call the patient, we call you up, hey, Ryan, we'd like to get you scheduled. And you'll say, well, I no longer have, ABC dental insurance. And we're like, oh, congratulations. And we let
you
it,
won.
we let it kind of sink in. They're like, well, what do you mean? They're like, well, now you don't have limited access to care. And by the way, we have a VIP membership that will allow you to come in. And was like, well, I don't have, even if you worked at ABC company, what a lot of employees or people don't realize is that dental insurance was being paid out of their paycheck.
Right.
They just didn't see it in the same way.
Right.
So there's still a slight out of pocket cost, but here's the benefits of being in this VIP membership. We reduce, you know, predeterminations. We give you the highest level of care, which we've always done. So we help the patients, if you will, understand the benefits of having a membership plan
Yeah.
and how to get
Yeah.
them back in the chair.
Yeah, I something just light bulb went off again. I can't remember if it was you that had mentioned it in the past in our conversations, but that concept of unrestricted care, an unrestricted provider, and people think that insurance is like unrestricted and unlimited, and oh, my insurance is going to cover it, and it's totally different than medical insurance. Even that's a whole debacle, but it is restrictive and it's limited. And when you look at this idea of membership, and now thinking of you as a provider as an unrestricted provider or unrestricted care, no longer does the provider need to, we use the term like treat to the nearest deductible, right? Well, what does my insurance cover? What does my deductible cover? Is that what you want as a patient? If you're trying to gain health and through oral health, like I only want to get as healthy as my insurance covers. And that seems silly to say, but like it's a common phrase, as I'm sure you hear all the time. Like, well, what does
Yeah.
my insurance cover? And I know that when I get healthy, I don't want to say it's just depending. My health is going to be dependent on what my insurance covers. I want to be, um, unrestricted. So, and obviously, providers and dentists want to do what they got into dentistry to do, and that's to treat people and treat patients and see them become healthy and successful, and not just like, okay, we're going to do this bare minimum today to get you to what your insurance goes. So that concept of unrestricted dentistry is really what we try to support, and what we build our software out, as technical as that is really to do that, empower the provider to be as unrestricted as possible, and helping them communicate that to the patient.
So if you think about it, the insurance done a great job of educating their clients that you have to go to their dentist, right?
Mm-hmm.
So you can only get this. But if you look at like a Sam's Club, they have a Sam's Club brand, but they got all the main brands as well. So you can
Mm,
get and you can get that. And that's where a membership plan allows you to go to the dentist of your choice. At least in our office, I need to be at my office, but
yeah,
we're going to give you all these benefits and we're not going to restrict what you can buy or what you need or what you want. We're going to take care of you like friends and family. So,
absolutely.
um, so one of the things that gets talked about a lot, and like you to take this wherever you'd like, but um, I have a philosophy because I know a lot of times membership plans, um, the hook is, well, you can only pay $20 a month for a year to get your membership plan or whatever the fee may be versus an annual membership fee. Now, I don't know which, I think you fall in the middle on both, but I'm a big proponent of the annual benefit or annual payment for the majority, not all, but for the majority of my clients. And my why is that if I have a patient who can't afford let's just call it a $450 annual membership, Ryan, if they can't come out of pocket for 450, which takes care of their two cleanings, x-rays, and so forth, and they got to break it down to $20 a month for a year in order to get a clean. They're not really the patient that
Mm-hmm.
most of my clients want. That's our why behind the annual. Now there are other offices that are happy to get that retention, and some of those patients are great paying and so forth. But where do you guys fall on that one, and how does that all work on your side?
Yeah, great observations there. I think at the root of that, there we really believe what you just said. That it's annual plans are better for everyone. Again, you're buying 12 months worth of loyalty, and is true or not. If the patient doesn't come back for their second sort of treatment, then you're sort of up 50% or whatever. Not that that's
Yeah.
your goal, but but you're buying loyalty, and they're going to be more committed to you. Um, as far as how and what our options, you're right. We're kind of in the middle. I mean, we've designed our software to be ultimately really whatever the practice decides. And, that's where we kind of differentiate a little bit between some of our competitors or some of the other software membership companies, is that they really want you to be in this box and they're only going to set it up that way. Ultimately, our memberships are pretty fully customized and our software works really well. But if you came to us and said, Ryan, I want a monthly fee and an annual fee, heck, if I wanted a quarterly fee, now let's not go too far down that end, but we do set that up. However, the practice likes, we'll guide them a little bit, and we do always um, mention, for all those reasons that you just said, excuse me,
Yes.
that the benefits of an annual plan. But at the end of the day, if they're really stuck on it, they really want to offer a monthly. What we do coach and consult them on is to say, you should still sell the idea of an annual plan to your patients. However, based on your demographic in your area, your neighborhood, whatever, if you've determined that you really want to offer that $25 a month or $30 a month plan, your communication should be to the patient. This is an annual plan. We expect you to pay 12 months at minimum, but as a convenience, we're going to break this up into 12 monthly payments for you. Just so you know, it's convenience. Oh, and by the way, there is a 20% surcharge and a $99 enrollment fee to utilize that convenience of those monthly payments. And the theory there is that, if somebody signs up for your plan, pays $30, comes and has their first visit, gets a discount, has their hygiene done, whatever, and then they bail and never come back, well, you don't want to be, out of pocket
Right.
or out for $30. So the idea there, and this is where, thing that Dr. Phelps has kind of really taught on. He has some calculations that come up with that as well. But like basically figuring out what is your chair time for that first visit and set those surcharge and minimum fee or whatever kind of to that, so that worst case scenario, they come and they bail, at least you're covered. And there's a lot of misunderstanding with offices in that way. But again, the truth is where we say you're selling an annual plan. And if you break it up into payments, that's a convenience. I agree with you that, if you're having to bait at that to that level, then is that going to be the ideal patient? Probably not. But, we have a client up in Idaho, and they live in a very agricultural kind of area, and they have 800 patients that are sort of migrant workers and field workers or whatever, over 800 patients on their monthly plan. And, it's definitely more of a challenge, definitely more. And they came to us from managing it. The doctor's wife and a couple of admins were managing 800 patients, paying $30 a month on a spreadsheet and their website and whatever else. And so they were very pleased. They become one of our greatest advocates and testimonials these days, putting it in our system, because our system is very smart. And if there's a failed payment or an updated card or whatever, I mean, those are 800 chances a month that something's going to go wrong and that payment's not going to go through. So it's definitely higher risk, but we've also put a lot of time and effort into developing our software to try to give you a best shot there. So yeah, we support both ways. I'm always going to guide clients to, go to an annual plan. That's your better bet. But if you're really stuck on that and you really want monthly, absolutely. But we're going to give you some guidance to make sure that it's not a loss leader by any means. So I agree with you on that one.
How do you help our clients when we refer to you? How do you set the fee for monthly? I'm sorry. How do you set the fee for the membership plan and what is included? Like, there's a lot of things that could be included.
Mhm.
It's bang for the buck, it's value, all those types of things. I think you and I even talked about in our membership plan. One of our offices we included parking, right? And it sounds silly, but we had a sign in front of the office
Yeah,
that
right.
said reserved for, our membership plan clients, and every hour, a half hour, they'd go out and change the name on the membership board. And it's a great attraction. It got other people who pulled up. It's like, what's with the front row parking and VIP membership? So it triggered, you
Yeah.
know, triggered a conversation. But how do you help an office set what's included in the membership plan, and how do you help them set fees?
I mean, ultimately, you can kind of over rocket scientists it. But at the end of the day, if they have no idea, we'll get their UCR fees, and we kind of have a little bit of a calculate. Used to be a Google spreadsheet with a few formulas. Now we have AI sort of produce the ideal flow. But at the end of the day, you're basically just adding up, 4 or 5 of your core preventative services, figuring out what that is, discounting that by 10, 15, 20% to kind of give it, a slight discount there, to sort of set your annual fee at that point. And, right now, today, depending where you're in the country, that's anywhere from, $400 a year to $600 a year. But you kind of come up with that core price. Again, cleanings, exams, x-rays, some basics that you want to kind of figure in there. Set that based on what those sort of fees are. But then where the real magic is the extra perks. What are those extra little things? VIP parking, free oral cancer screening, free whitening, and I said it, slipped myself there, complimentary, this is back to Dr. Phelps and his persuasion sort of ideology. What are some ways that you can put this value or increase the value of your plan pink stuffed animal when you come into practice, free cookies, like whatever. Again, what are those things that you can say, hey, our membership fee is $400 a year and it includes cleanings, exams, etc. However, you get a $500 off of cosmetic, you get a free cosmetic consultation, you get, get all these things. So the value, like you said, the value of our membership plan is $1,100 and you're getting it for $449 or $439 or whatever. And a lot of times, offices are so set on, okay, we're going to have 2 cleanings, 2 exams, and, a 10% discount on production. Well, what are those other things that you can throw in that are little to no cost to you as a practice, but then really increase the experience and also the perceived value? Because you don't want to fluff it up with a bunch of crap. But like, what other experiential sort of stuff can you give? Free parking in the front row of your dental practice. I know that my partner Dr. Sindelar, they've got some pretty tight parking there
Yeah,
at their
they
place,
do.
and you got to park next door, sort of a little shopping center, or whatever else. But if they had a spot there, if I knew I was a member, for the most part, well, now they have so many members, maybe I'm not going to
Sure,
by default
sure.
get it, but what are those other perks that you can do? And so many times you just have to ask practices, get a little creative. What's unique about you? Are you in a shopping complex? Do you want to work a deal with the ice cream shop next door that says you get a free ice cream or something? Like, what are those things you can, again, you're making like a med spa bundle, a spa bundle. Like, what's a thing
Yeah,
other than just your cleanings and exams? How can you make that exciting, enticing, valuable, and exclusive feeling so that next time they're thinking about switching dentists, they're like, well, that guy, all I get is cleanings and exams. But over here, man, I feel like a VIP because of all this sort of stuff.
yeah,
So go back to the value of it. The bare bones are just helping them figure out their UCR fees. And sometimes they want to get down to the penny. And we also want to keep it simple, stupid sort of idea. So it doesn't need to be down to the exact penny and just a ballpark, make it easy for the clients to know what it is. And it's clean and clear cut. So yeah, we can help them figure it out down to the penny, but ultimately we're going to come up with a suggested price, around 400 to 500 a year for an adult and maybe a little less than that for a child.
yeah. I like you know, the value add, if you will, right? Because it goes back to even the simplest things. So many patients think that a toothbrush, floss, a goodie bag at the end of a visit, they think it's free because they think they get that stuff free from Crest or Flora, from whatever dental brand is, if you will. And so we even offices that don't have a membership plan, on the statement we put, toothbrush, floss, gum, whatever it may be, $6 compliments of the doctor, and
Yeah.
let patients know. So all those kind of things are really important.
Yeah, absolutely.
So,
Yeah.
um, what what makes you guys, there's a bunch of different membership plans out there. Where do you think you guys differentiate yourself from everybody else?
You know, some of it excuse me, let me back up. Some of it is some of our philosophy and what we are very high touch, high, white glove, high customer service. I mean, we are a smaller company compared to one of the bigger competitors in this space, but really we want, I know it sounds cliche, but we want the best for our clients, and we are in the dental, so we're dentists and dental, owners first versus tech people. So our philosophy and why we want you to grow, I think comes through a lot of our testimonials show that. So we're really hands on. We really want to design something that's unique to you, and that comes down to everything from our branding and how we set up our plan. So when clients on board with us, we ask them, what do you want to call your plan? We're not making you sell Smile Advantage plans because that
Right.
sounds like an ugly third party that you're selling. Like, don't come to my Oakville Dental Care and sign up for a Smile Advantage plan. Call it whatever. Call it, Schwartz Family VIP plan or concierge plan or whatever. So that's one big differentiator from, us and some of the others, is that we want it to be your thing and we're going to facilitate that. So everything from like emails that you get from the patients get from our software to, communications, that's all coming from you. It's the practice. And again, if we're trying to remove insurance as this awkward third party between the patient and the provider, well, then that's what we want to do too. So Smile Advantage is really just this technology that powers that, just like your appointment reminders. Dental Intel is going to send you reminders and stuff. So that's a big differentiator from us. The real biggest one is the cost, the fee structure, and how we charge for our software. When membership kind of started to gain mass industry adoption, the model was charge the dentist $2 or $3 or $4 per patient, or 5% of what their membership revenue is, as sort of a taken off the top by the software company. And my partners who are providers and practice owners and successful ones at that, they're like, we don't feel good about our, doing that to our colleagues. We want this to be a profitable thing for them. And so how we charge for our software is a fixed fee. It's a flat fee. We don't take a percentage of your sales. We don't charge the patient $3 or $4. And there's all kinds of like trickery now that's happening with trying to make it look like, the software providers are not charging it. Well, the patient actually pays the $3 or $4 fee. Well, that's $3 to $4 then you could put back in your pocket, and that's still revenue that you have. If the patient's willing to pay $36 instead of $32, instead of giving that to the software company, why don't you as the practice owner keep that and use that to grow your practice? So the big one for us is the pricing. It's a fixed fee. We don't charge you per patient. We have standard and low competitive processing rates for our credit cards that go through the system. But that's a real big differentiator is that, 50 or 5,000 patients, you're going to pay the same for our software, and it does its job. The other one is that we really do a lot of customized marketing. Kind of goes back to the branding of it. But when you onboard with us, you get a full set of complimentary prints, and we actually ship those full 8.5 by 11 customized designed brochure with your logo and your branding and your information and your specific program details are all on there. We'll ship a couple hundred of those to you. You also get some postcards. They're a little bit smaller that are much easier to hand out in a hygiene bag or to hand out at the front counter or hand out at the local shopping complex or whatever. So we give you some pretty hefty marketing materials right out of the gate. And then every year that you're with us, when you renew with us, you can say, hey, Ryan, hey, Shelly, I want some extra printed brochures, and we'll ship those to you every year you're with us.
But
So you get another
they're touch
complimentary.
items, and I've seen them in Jeff's office. They're touch items that the client can take with them. They can see what their benefits are. They're they're branded. They're even on the screen monitors in the treatment rooms from time to time.
Yeah.
They're on TV in the reception area, running through. It has a very, very positive impact.
Yeah, absolutely. So as that's a big component. Is instead of just giving you a generic trifold brochure, I mean, really, we put a lot into that to helping you get exposure out there. We've got email templates. We've got a whole library of content. If you want to do a billboard in your neighborhood, we've got some billboard designs. And you say, hey, Ryan, I want billboard design number 7. We'll tweak it and customize it to you and send it to you. You send it to your printer. Or if you want to do like we're queuing up this morning, a blast of 5,000 postcards that a client wants to do. They're opening a new location, and so EDDM, we have wholesale printing capabilities for that. Some of that other stuff we just charge you our cost on, so we're not even really marking that up. So again, we really want them to grow and benefit from growing that. So the marketing asset of what we're doing is a pretty big differentiator. So fee structure change difference, really the support and marketing you get, and then really customization and white labeling sort of your membership is really kind of what sets us apart from some of the others that are out there.
Do you guys train the teams on how to pitch and sell the in-house program? Do you guys
We
do phone training? How do you go about that?
we do that. Just like with yourself, we have partners that we work with that that can help chime in on that. We have what we call our Advantage Academy, which has a bunch of different IDs in there and scripts in there, and they do get our clients get up to 2 hours of live training via Zoom, and most of the time they get it after the first one, so they never utilize the second one. But in that, we talk a lot about what's your office like? Are you in a complex? Are you what? And kind of go through some of those conversations that they can have to sell the membership, better to the patients. I was on a podcast a couple weeks ago talking specifically about the team training aspect of that, and I think you probably agree with this, and that oftentimes practices see this membership as like, oh, this is just something that Jennifer does, the treatment coordinator, once you go through the office, and that's sort of Jennifer's job is to sell the memberships. And really what we see is that the most successful practices are the ones, and you notice it at my partner's practice, that the whole practice is talking about the membership, everything from how they answered the phone to reception when they check in. The assistants are talking about it because there's a brochure in the operatory, or, when the whole team gets involved in talking about the membership, patients come there and they know, oh, this is what they do here at Oakville Dental Care. They have a membership. If you don't have insurance, they have a membership. So again, the really successful ones are the ones that are constantly talking about it. So actually, we didn't even talk about this, but I'll in the show notes, and when we get this blasted out, I've got a pretty cool little white paper that's 10 conversation starters for your whole team to talk about memberships. And maybe we'll do a Kelly Schwartz customized version of it. And it's just everything from the assistants to the doctor to an associate to the treatment coordinator. Like, here's a couple of one-liners of like how to initiate that conversation to bring up the membership. So we'll do that as a little giveaway resource after when we have kind of launched this podcast. But yeah, so we help them out with some of those conversations along the way.
We've had some offices, they're as a marketing type thing, today's market, getting good employees is hard. Having benefits is important. we put together with your help little membership programs and going to owners of small businesses with like 10 employees. It's like, hey, how would you like to offer your team dental insurance or a form of dental care?
Yeah.
Because you can't say insurance. They're like,
Right.
well, what do you mean? Well, we have a membership plan. We'll make it exclusive for your team. It's $400 a year. You could pay 200, your employee could pay 200, and here's what they would get. Next thing you know, you got five, six, seven, eight people. We've done it with some hairstylists seem to be very
I,
popular
I
because
was just gonna say, yes, it
they're
seems like,
always talking to people, and you got to capture an audience for half hour to an hour, right?
yeah, yeah.
And so they'll almost put the hairstylist on a commission, for everybody you send over. So we've seen some unique ways of doing that, and so, what else do my clients or our clients need to hear about Smile Advantage and what a great job you're doing, and what do they need to know, and how do they get in touch with you, and so forth?
Yeah, I was going to joke and I say we have 3 or 4 different salon suite style marketing templates in our brochure,
Yeah,
our template library that they can choose from because that has been pretty a hot
yeah,
topic.
it's great.
Yeah. As far as yeah, how we can help, I think one thing that we do really put a lot of time and effort into is really just kind of taking you where you come from, where you're at in that journey of from just hearing about it because I went to a conference and I heard them talking about a membership program to I've been using another software company and I'm paying thousands of dollars a month. Or in the middle there, there's kind of 3 buckets that we talk about. You don't have any membership and you're wanting to get started, or the middle bucket is kind of the bigger opportunity for us as a company, is that we call them the DIYers, and they're the ones that have started a membership and they've kind of managed it, self-manage it in their practice management software or spreadsheets, and they're realizing it's growing and it's slipping through the cracks and it's hard to manage at that point. And then the others that are using a third-party software and they're realizing that they can get a much better experience with our software at a much lower fee. Better customer service, all those things. So if those 3 buckets, wherever you are in that journey, we can help you. If you're using another software and you want to migrate all your clients, or you're using a spreadsheet and import them, we've put a significant amount of time and effort and resource into taking you where you're at and then getting you into our system and getting you to sort of the next level and growth with your membership. So that's who we can help and how we can help. If you've got a bunch of crazy marketing ideas, we can help facilitate that as well. Or if you just need sort of a second opinion on, hey, here's how our fees are. You want to try to do it yourself, we've got some free marketing resources, design some of our free or download some of our free designs and try yourself. And then when you have success and you want to come back and help us, have us help you manage it, we can do that as well.
Okay,
So get
I
involved with us. Yeah, just our website,
no, go ahead.
smileadvantage.com. And we'll put a link there. We've got Kelly Schwartz and Schwartz Consulting's one of our partners. So they're listed on our website. So we'll have a nice little landing page on there and you can contact us through there or link us through Kelly.
So I cannot emphasize enough the importance of membership. I've been traveling for 30 years. Marriott has its membership, National, American Airlines, and so forth. And because of my, loyalty through the membership with Marriott, for example, I've got 2,600 nights in a hotel. I'm top level Marriott, and I will always stay at a Marriott if I can because of the loyalty, the service, the value. One of the things I like with National is I get to pick the car I want for the price of a full size instead of an upsized car. So there's some definite advantages to building a loyalty program with your patients, and it really starts with service. But as Ryan said, our website, kellyschwartz.com, go to our partners page and Smile Advantage, click here. You get some information. You can schedule your demo. Everything that you need is right here at your fingertips. So, Ryan, any closing comments or anything that we need to know?
I was going to piggyback on that, whether it's your clients or our clients, whatever. One thing that we really do like to when we work with elite level consulting groups is that we can work together. And there's been some drop off, and some consultants think that they're going to send over their clients, and we're going to counteract or contradict what they're saying. And it's the opposite. I mean, we love working with your clients and other, Chris Phelps's clients, because we can just work with you and determine what's the best case scenario for the practice. So when you work with us through a consultant like Kelly, you're getting the best of both worlds, and we really can work cohesively. And you determine him, do the hard work with Kelly, and then we'll work with Kelly and set up your membership to be that way. And so you kind of get a three parties involved when you're working with both of us like this. So anybody that's listening that's on Kelly's list there or my list, you get sort of the best of both worlds. Our clients, if you're hearing this and you want an extra hand and a little further practice philosophy and practice growth, again, we can pull Kelly in and kind of go through some things and talk through things. Maybe your practice is a little out of whack over here, or you want to bring some things up to speed before or while you're managing a membership. Kelly's a great resource for a lot of those things as well. We can kind of collaborate and team up to get your practice up to the next level.
Well, Ryan, thank you today. We really enjoyed the information. Everybody needs to have a membership plan. It's a great marketing tool. It's a great sense of keeping your patients retained in your practice,
Yeah,
and it is a revenue, stream. So
yeah.
keep up the great work over there at Smile Advantage, Ryan. Thank you for giving everybody your time today and the information.
Appreciate it, Kelly. Thanks.
All right, have a great day.